News title, A Hearty Debate, Unveiling the Link Between Artificial Sweeteners and Cardiovascular Risks. TLDR, new studies shed light on the potentially damaging effects of artificial sweeteners on heart health, stirring debate on their use as sugar substitutes. Increased cardiovascular events, inflammatory reactions, and the lack of long-term weight loss benefits pose questions on whether the sweet taste of these substances is worth the risk. Contrary to long-held beliefs, artificial sweeteners, often employed as sugar substitutes in the diets of those combating obesity and diabetes, could be doing more harm than good. New findings suggest that these non-sugar sweeteners, NSS, may contribute to a 9% increase in cardiovascular events, such as heart attacks and strokes. Does this mean that it's time for us to reconsider our stance on these sweet substitutes? Traditionally, these sweeteners were championed for their ability to promote weight loss and reduce blood sugar levels, making them seemingly ideal for those dealing with weight and sugar-related health issues. However, the tables are turning as new guidelines from the World Health Organization, WHO, advise against the use of NES for weight control or reducing the risk of non-communicable illnesses like diabetes, obesity, and cardiovascular diseases. The reasons behind this shift in perspective might be manifold. Some experts propose that certain artificial sweeteners may increase the propensity of clotting, agents like platelet aggregation, leading to clot formation and triggering heart attacks or strokes. Could this propensity be one of the hidden dangers lurking behind these sweet substitutes? Furthermore, it's suggested that these sweeteners may induce inflammation in the gut, leading to unhealthy vessel walls. This effect could be particularly harmful for patients already at risk of heart disease, such as those suffering from diabetes and hypertension. Is this another alarming side effect we should keep an eye on? According to Dr. Ajeth Deer, Director and Head of Cardiothoracic and Vascular Surgery, CTVS, Fortis Memorial Research Institute, artificial sweeteners should be approached with caution. He indicates that aspartame may be linked to stroke risk, while sucrose and stevia may be associated with cardiovascular disease risks. Are these associations reason enough to reconsider the usage of these sweeteners? Systematic reviews have revealed some short-term weight loss benefits from using NES, but there is no evidence of long-term benefits in reducing body fat. Indeed, long-term use of NES could lead to increased risks of type 2 diabetes, cardiovascular diseases, and mortality in adults. The sweetness of these substitutes seems to be undermined by their bitter after-effects, doesn't it? As we grapple with these findings, it's clear that there's a need for comprehensive guidelines on non-sugar sweeteners, especially given their rising consumption in India. As we move forward, we must ask, are we willing to make informed choices on our consumption of artificial sweeteners based on these revelations, and is the sweet cost truly worth the bitter consequence? First seen in India.